Hi everyone. Today I will be discussing delegation in nursing, how we build trust and ensure accountability. Delegation is a vital skill in nursing that improves efficiency, teamwork, and patient outcomes. However, it's also a skill that can be challenging to master. In this presentation, I will cover what delegation is, why it matters, the 5 rights of delegation, common delegation errors, and strategies to ensure that delegation is done effectively and safely. I want you to think about a time when you had too many tasks to complete on your own. How did you manage it? Did you ask for help? How did that go? This is exactly what delegation in nursing is all about. Ensuring that care is delivered efficiently by the right people while maintaining accountability. So let's get started. Why is delegation important in nursing? Delegation is essential in nursing for several reasons. Delegation improves efficiency. Delegating tasks ensures that every member of the healthcare team can focus on what they do best. For example, a nurse may focus on patient assessments and care planning while delegating routine tasks like vital signs to a CNA. Delegation prevents burnout. Nurses have demanding roles. Without delegation, the stress can lead to mistakes, fatigue, and burnout. Imagine a nurse who's trying to handle all patient needs, from administering medications to performing wound care without any assistance. The quality of care could diminish and the nurse may become overwhelmed, and this would lead to not providing good patient care. Delegation also helps and strengthens teamwork and growth. Delegation allows team members to gain experience in various patient care tasks. For example, by delegating some tasks to nursing assistants or LPNs even, nurses can help them develop skills they can use to contribute more to patient care. According to the American Nurses Association, proper delegation supports patient safety and operational efficiency. So consider a typical shift where a nurse is responsible for 5 patients. If the nurse tries to complete every single task alone, medication administration, patient assessments, ambulation, and vital signs, it would be impossible to provide timely care for all patients, and some tasks might be skipped. Delegation allows for a balanced workload, better time management, and improved patient outcomes. By working together and delegating appropriately, we enhance not only our productivity, but also our ability to provide excellent care. So, learning objectives. By the end of this presentation, you will be able to define delegation and understand its role in nursing, apply the 5 rights of delegation in practice to ensure safe task delegation, identify strategies to overcome delegation challenges and build trust within a nursing team, and you will also be able to recognize common delegation errors and learn how to avoid them. As you listen, think about your clinical experiences. Have you ever worked with a team where delegation worked well? Maybe during a busy shift when tasks were efficiently divided and you saw positive results. Or perhaps you've seen situations where poor delegation caused confusion or delays. These examples will help frame our discussion today. So, what is delegation in nursing? Delegation in nursing is when a nurse assigns a specific task to qualified team members while still being accountable for patient outcomes. So, for example, a registered nurse can delegate tasks such as vital signs to a CNA, but the registered nurse is still responsible for interpreting those vital signs and taking action if something is abnormal. This is a perfect example of how delegation allows a nurse to focus on complex tasks while ensuring that necessary tasks are still completed by capable team members. Delegation isn't just about handing off work. It involves providing clear instructions and ensuring that the tasks will be completed with appropriate oversight. For example, if a registered nurse delegates medication administration to an LPN. They must ensure that the LPN has the right training and is aware of the patient's medical history. This will ensure safe care delivery and minimize risk. So a nurse can delegate checking blood pressure to a CNA, but the nurse must evaluate the results. If the blood pressure is abnormal, the nurse will have to make decisions based on that information on what to do next. The 5 rights of delegation. To delegate effectively, nurses must follow the 5 rights of delegation. The first one is right task. Right task involves assigning tasks that are within the scope of practice of the delegatee. For example, a CNA can assist with patient hygiene, but they cannot administer medications. Number 2 is right person. The task must be assigned to someone with the proper qualifications. So for example, an LPN can administer oral medications, but an LPN is not authorized to administer IV medications. Number 3 is right circumstance. Right circumstance assesses the patient's condition to ensure that the task is appropriate for delegation. So, for example, if a patient has dysphagia, which is difficulty swallowing, feeding should not be delegated to a CNA without proper supervision from a nurse. Number 4 is right direction and communication. Right direction and communication provide clear, specific instructions. So instead of telling a team member to go check on the patient, you want to specify exactly what they need to do and what needs to be done. So instead, you can say, please go take room 3's blood pressure before lunch and report it back to me. Number 5 is right supervision and evaluation. So right supervision and evaluation is after the task is delegated, the nurse must monitor its completion and assess the outcome. For example, if a LPN administers medications, the nurse must assess the patient for side effects or complications. By following these 5 rights, we ensure safe and effective delegation. Missteps in any of these areas, which can lead to errors that will affect patient care. Common delegation errors. So delegation can sometimes go wrong, leading to errors that affect patient care. So let's discuss 3 common delegation errors and how to avoid them. So under-delegating. Under-delegating occurs when nurses hold onto too many tasks. This often stems from a lack of trust in others or a desire to maintain control. So a nurse might insist on doing all patient care education themselves, even when the task could easily be handed over by an LPN or CNA. So under-delegating can lead to burnout and reduce the effectiveness of the nursing team. Over-delegating happens when nurses delegate too many tasks to others, overwhelming the team members. So a nurse may ask a CNA to handle multiple patient care tasks without considering their current workload already, which can then lead to mistakes or missed tasks. Improper delegation or improper delegating is when a nurse assigns tasks to individuals who are not qualified or prepared to perform them. An example of this would be asking a CNA to administer medication, which is outside their scope of practice and can lead to serious consequences, especially medication errors or even being fired. To avoid these errors, nurses should assess each situation carefully, communicate clearly, and match tasks with the appropriate skill level. So my 2 learning activities and strategies that I'm going to have you guys do. First one is a Kahoot. It's just 3 questions over delegation, and here's my game pin. And then I've also included a case study. I encourage you to hit pause and spend a few minutes reflecting before moving on to the next slide. So it just has 3 questions. And then the answers are provided here for the case study. The task for the CNA would be helping assist Mr. Jones walk to the bathroom. Task for the LPN would be checking the blood sugar. And then task for the nurse would be administering IV pain meds and providing discharge teaching. So, key areas of focus for effective delegation in nursing. Delegation can be challenging. Some common issues include team members not wanting to accept tasks. This can happen if they feel the task is too difficult or outside of their scope of comfort. As a nurse, it's important to offer support and ensure they feel confident in their ability to complete the task. There's also unclear instructions leading to mistakes. So clear communication is key to successful delegation, because without clear specific instructions, team members may misunderstand what is expected, which then leads to errors. Lack of trust between nurses and staff. Trust is essential for effective delegation. If there is a lack of trust, delegation can feel like micromanagement, and team members may resist it. So, to overcome these challenges, and you can build team trust in overcoming the challenges, you can use effective communication. You want to be direct and clear with your instructions to make sure the tasks are done right and on time. You want to build trust through teamwork and collaboration. This can be done by acknowledging team members' strengths and giving them opportunities to take on more responsibility. And then you can also offer feedback to reinforce good delegation practices and improve team dynamics. This will also provide learning opportunities for them when later on they might be able to help with more. Connections to relevant experience. So during one of my clinical shifts at the medical center, I was assisting a nurse who had multiple patients to care for, including one who needed frequent vital signs. I observed how the nurse delegated the task to CNA. She explained clearly which patient needed monitoring and when to report any concerns. Seeing how the nurse trusted the CNA's skills and followed up afterward showed me how effective delegation builds teamwork, trust, and accountability. This experience helped me understand how delegation allows nurses to manage their workload while ensuring patient safety as well. I could tell they had a really good relationship, and a lot of times they also did cluster cares, and it just made their day go by faster and made their day so much easier while still providing good patient care and being a team throughout the whole shift. So I have 3 critical thinking questions. My first one is, what could happen if delegation is not done properly, and how can nurses prevent this? My second one is, what is the difference between accountability and responsibility in delegation? And then my third one is, what steps can you take if you face resistance when delegating tasks to a team member? So, delegation in nursing, final takeaways. Some key points to remember are that delegation ensures safe, efficient patient care. The 5 rights of delegation guide safe practice. Avoiding common delegation errors helps maintain safety and efficiency. Trust and accountability strengthen nursing teams. And by mastering delegation, nurses can lead more efficiently and improve patient outcomes. Conclusion: effective delegation for better patient outcomes. So, in summary, delegation is an essential part of nursing practice. I also really enjoyed doing this presentation because we are getting closer to becoming nurses, and one day we will have to delegate tasks to others and make sure we are providing those tasks to the right person with the proper skills. So today we explored its importance. We explored common delegation errors, strategies for overcoming challenges, and how to ensure accountability. I encourage you to apply these skills in your clinical practice as well as your work life and later on when you're a nurse, and reflect on how effective delegation can improve your workflow and patient care. And then these are my references. Thank you for listening.